Hello, so this is the lecture for Physiology of Hearing, Taste, and Smell. So for our outline, this would only be cover physiology of hearing. So I leave it to you guys to read about physiology of taste and smell on your own, and reference books would either be Dighton or Vernon Levy. So let's talk about physiology of hearing. To understand how we hear, it is important to take note how sound waves are converted into action potentials. So now let's look at how do we hear sound waves. Now sound waves travel through air as vibrations of air molecules. Now we will go from the outer ear down to the middle ear, then into the inner ear. So the first structure would be the pinna or the auricle. Now some books would say the pinna would serve no purpose with respect to hearing. However, recent studies show that the shape of the pinna changes the quality of sound waves that would enter the outer ear and into the middle ear, which helps us localize the sound. So the pinna is a cup-shaped structure that will funnel the sound waves into the external auditory canal. Now sound waves collected by the pinna or the auricle is funneled through the external auditory canal, and this sound waves will hit the tympanic membrane. Now other important features of the auditory canal is that it is lined with several glands that will produce earwax or cerumen. Now, cerumen has antifungal and antibacterial properties, which is important in protecting the auditory canal. Now, in the clinics, a lot of patients would clean their ears using cotton buds or any other tool which they will stick inside the auditory canal. Now, a lot of times, cerumen will be pushed back by these cotton buds up against the tympanic membrane, and in time, it will harden and that will cause impacted cerumen. So when sound waves hit the tympanic membrane now vibrates. So here are the properties of the tympanic membrane or the eardrum. It is said to be sensitive, meaning it is able to detect vibrations as small as the diameter of a hydrogen ion. When we say periodic, the tympanic membrane is able to faithfully replicate a wide range of frequencies. When we say well damped, the tympanic membrane vibrates when sound waves are present, and when the sound stops, the tympanic membrane also stops vibrating. And it is also able to distort sound waves greater than 45 decibels. So this will enable us to create harmonic overtones, which enables us to understand a specific sound within a sea of noise. So when the tympanic membrane vibrates, this vibratory force or pressure will now be transmitted by the ear ossicles. So we now enter the middle ear. So this vibratory force will be carried by the malleus, then the incus, then the stapes. Now these ear ossicles are important because they reinforce sound waves and they function for impedance matching, which we will discuss shortly. Now the ear ossicles will have to convert high amplitude, low pressure waves into low amplitude, high pressure waves. Later we will discuss why is it important for sound waves to be converted into low amplitude, high pressure waves as it enters the inner ear. Also, the ear ossicles are said to be sensitive around 300 to 3000 cycles per second. Now let's look at other important structures found within the middle ear. So first you have the tensor tympani. Now this is a skeletal muscle inserted into the malleus, and this is innervated by the trigeminal nerve. When this muscle contracts, it will pull the malleus inward, together with it the tympanic membrane. A second muscle is the stapedius. This is inserted to the stapes and it is innervated by the facial nerve, such that when the stapedius muscle contracts, it will pull the stapes outward, together with that the oval window. Now these two muscles are important for the acoustic reflex, which we will discuss in a while. Another important structure would be the eustachian tube. Now the eustachian tube connects the middle ear to the oropharynx. Now, in the transmission of vibratory pressure, it is important for the pressures in the environment and in the middle ear to be equal for the tympanic membrane to vibrate properly. Otherwise, the transmission of pressure into the middle ear or through the middle ear will be decreased. Now, this is observed when pressure outside the pinna or in the environment does not equal the pressure inside the middle ear. A classic example of that when we take a plane ride. So when the cabin pressure is increased, so external pressure is higher compared to the pressure inside the middle ear, this will now push the tympanic membrane into the middle ear, decreasing now our ability to hear. Now, in order to alleviate this, we need to now equalize the pressure between the middle ear and the outer ear. Now, in order to do that, we need to open the eustachian tube. Now, typically, in doing this, we yawn or swallow or chew something. So that will now open the eustachian tube and equalize the pressure between the outer ear and the middle ear, bringing the tympanic membrane back to its proper position. Now let's talk about the acoustic reflex or the attenuation reflex. Now this reflex is activated when we hear a loud sound. What happens is that when we hear a loud sound, the tensor tympani and the stapedius muscles will contract. This will now pull both the tympanic membrane and the oval window into the middle ear. This will also compress the ear ossicles. So when that happens, the transmission of vibratory force or pressure through the middle ear decreases. So that dampens now the vibrations. So this decreases the sound entering the cochlea by around 30 to 40 decibels. When we shout, this is a loud sound which then activates the acoustic reflex. So when that happens, this will decrease our sensitivity to our own speech. The function of the acoustic reflex is that it protects the cochlea from loud tones, most especially for loud low tones, and this masks low tones. Now let's talk about impedance matching. Now, impedance matching is important in order for us to hear sound waves. Now, take note that the cochlea in the inner ear contains fluid. This is endolymph and perilymph. Take note also that sound waves travel through air as vibrations of air molecules. Now, in order for us to hear sound waves, pressure vibrations of air must be converted into pressure vibrations in fluid, which is more difficult. Take note that because of inertia, fluid molecules would be more difficult to move compared to air molecules. But this is solved by impedance matching. Now, impedance matching is basically due to the relative surface area of the tympanic membrane and the oval window. Together with that, you have the ear ossicles. Now take note that the relative surface area of the tympanic membrane is much larger compared to the surface area of the oval window, such that when sound waves hit the tympanic membrane would gently vibrate. Now this vibratory pressure will be funneled through the ear ossicles into a relatively smaller membrane, the oval window, such that slight vibrations of the tympanic membrane will now cause greater vibrations or vibratory force into the oval window. So it is said that the force generated is increased by around 22 times, and this helps us increase our sensitivity to hearing. So the impedance matching is said to increase intensity of sound by around 30 decibels. We now enter the inner ear. Now the inner ear contains several important structures. So first, from the oval window, we have the vestibule. On top of that would be your semicircular canals, which are important for maintenance of balance. And of course, we have the cochlea. So the cochlea will basically house the hair cells that will detect sound waves. They will now be converting motion of fluid vibrations into action potentials.